Hello, everyone. Happy Wednesday. This is the Medieval Medicine, Medieval Diet lecture. You'll have a short quiz on this that'll be on Learn, just to hammer home a few points that I hope are clear from the slides. It's going to be mostly a slideshow with some narration. Should go pretty fast. When I initially planned this day of the course, I was thinking I was going to look at sort of all of the nuanced medieval diet text and how they continued the ancient traditions and innovated things in new ways and brought up new conversations. And then I realized that I just didn't care about that. And I don't think you do either. Uh, because what's most important about this day in the class is thinking about medieval medicine more generally and thinking about how it worked in the medieval world and uh, its place in between classical medicine that we looked at Monday and Renaissance medicine that we're looking at on Friday. So this lecture is going to be pretty broad in the sense that it's really more about sort of medical practice and the Western medical tradition more so than diet in particular. I think that makes it actually more useful. The whole point of this week in the class is to really think about the long history of diet. And even though we focus more on the 19th and 20th centuries in this class on the whole, it's important to understand that physicians arguing about what is healthy food, what is good food, how nourishment works, that's been going on a long time. We've already seen that with Hippocrates and Galen in the ancient world, in the classical world on Monday. We'll see it today. We'll see it on Friday. So this week really kind of establishes that sort of foundation, the bedrock of the Western medical tradition as pertains to diet. There's a fair amount of repetition in all 3 days. This is probably the most boring week of the class. I think it's very important. I mean, I thought a lot about just cutting it out because it is very different from the kind of dietary advice that we're used to. But at the same time, I think it plays a very important role in establishing that long tradition. I'll warn you, the reading for Friday is really dry, and it's not fun. It's informational. It's really good. I think it's really clear. It highlights a lot of differences between the Hippocratic and Galenic texts that we looked at, and we'll see again today, and then sort of new things that are happening in the Renaissance. And that sets us up really nicely for what we're doing next week. So good luck. It'll be fun. It's important, but it's not fun. So I just want you to know that because some of you in your reading responses have said this was not very engaging reading, and I, maybe didn't get as much out of it. So that's going to happen on Friday. So push through it. I showed you this on Monday, some fragments of a Hippocratic text called Epidemics. When we think about medical text and the Western medical tradition, there's not only a tradition of knowledge, but there's a tradition of text, right? It's a physical thing. Knowledge, of course, passed down orally from one practitioner to another, one family member to another, and so on. But a lot of what we're talking about and what really is the foundation for dietary advice comes in written form as well. Here's another version of a Hippocratic text. You can see in the first line, Vita brevis, ars longa. Life is short, art is long. The importance of writing things down, the importance of a physician, of learning from other physicians that have come before him, and doctors at this time were predominantly men, and learning from the experience of other people, not just what you've personally experienced, but how you can generalize about medicine from everyone else. So here's a typical, looks like 14th, maybe 15th century manuscript. Here's another one showing the use of the manuscript. It's not just a text written down. People are taking notes in it. We'll talk more about this at the end of the lecture as well. This is another Hippocratic text. These are being preserved very carefully. Here's an early modern printed edition, late 1400s, maybe early 1500s. Same text as the manuscript, if you look up in this first line, Vita brevis, ars longa, life is short, art is long. And then eventually you end up with very lavish editions from the Renaissance, and we'll see some images of these in the reading for Friday. This book is, as you can tell from the title page here, Hippocratic text both in Greek and in Latin. When we talk about sort of the text of Hippocrates or Galen or any ancient physician, we're not talking just about exactly the words that they wrote. Now we take it for granted when somebody writes something, it's preserved verbatim, word for word, digitally, really easily. Ancient text, some of the texts we have of Hippocrates or of Galen, they only exist in Latin, even though they were written in Greek. They've been translated into other languages, sometimes many times. Some of our only original texts of Galen were translated from Greek into Syriac, and then into Arabic, and then into Latin. And we've lost all the other editions, and we just have the one now in Latin that's a product of many translations. If you've ever played the telephone game, you know that corruption sort of naturally gets into a message or text over time. It doesn't necessarily totally alter the meaning, although that can happen. So it takes a lot of work for us to go back and figure out what sort of more or less the originals were. But when we talk about Galen and Hippocrates, we're really talking about a long textual tradition, because we don't have accurately their exact words anymore. We have, hopefully, good approximations of their ideas, but there's always that balance between the fact that it's been copied and used and interpreted and reformulated and translated back and so on. That's going to affect what we think these people said. And of course, all of that work, though, to understand what a Hippocratic text is, or what Hippocrates wrote, or what Galen wrote, when we look at a modern edition, which we obviously saw this on Monday, it looks so obvious. It looks so easy, right? It's just a regular printed text for us now. But we have to keep in mind that long textual tradition of manuscripts and early printing and many editions and so on. That's really the foundation. When we think about how do we know anything about the history of diet, that's what it looks like physically, all those slides. Okay, I want to just do a very quick review of humorism. This is a diagram that sort of synthesizes or summarizes a lot of what you saw in Galen's reading. We'll see this again on Friday. This is a good summary. It's really ugly. The medieval manuscripts often have versions of this. One of my favorites is this one, which is also, it says the same stuff as the other one does: fire, water, earth, air. It's got the 4 qualities. Same information, just I think a much nicer display. You can also see on the outside here the zodiac, the signs of the zodiac. Medicine and astrology were very closely coupled in terms of looking to the heavens, looking to the stars to determine when treatment would be most effective, or relating parts of the body to astrological signs to think that a treatment to a certain part of the body will be most effective at a certain time of the year. It seems really ridiculous and irrational to us, possibly, but keep in mind one of the things that medieval medicine was trying to do was to find order in chaos, right? People are sick. There's lots of diseases. They manifest slightly differently for different people. It's hard to know what to expect. It's hard to know what the regularity is, to find the natural laws governing disease. And one thing that's constant in the world, everything's changing all around us, but the one thing that's constant is, every day over the course of the year, you can go out and you can see the same stars in the same pattern. We can go out now, look up, and forget about the smog and the smoke and all that light pollution. But we can see the same stars in the same configuration that Hippocrates or Galen did. Okay, this is another medieval manuscript of a Hippocratic text, and the exact text here is not the point, but the shape of the text, which is a cross. There was a very tight coupling between medicine and religion in the Middle Ages, and we see that very particularly in terms of monasteries. Here's Saint Benedict of Nursia. He created the Benedictine rule, which is the kind of the first, set of rules and prescriptions for monastic life. You can see his dates down here, lived sort of in the early 500s. And what's interesting here is the emphasis on medical practice in terms of what monks were supposed to do. And this reference to the abbot being a wise physician, comparing an abbot who runs a monastery to being a wise physician. That's an interesting comparison. But healing in monasteries was very important. Not only were they taking care of themselves, and the male and female monasteries taking care of themselves, but they would take care of anybody that needed medical care. That was part of what sort of the religious sentiment dictated. You had to serve everyone as if they were Christ in person, right? Especially the sick. They are the ones that were copying texts, Hippocrates, Galen, and so on. Lots of other authors that I'm not bothering to mention. So I keep saying those two because they were two probably the most important. But there's a lot of other ones as well. Copying texts and actually using them as well. The link between medicine, healing, and divinity, and spirituality, and Christianity, I think is represented very well in this kind of image. This is Hippocrates across. You can see at the bottom here. And the image, as we looked at last time, is irrelevant. We don't know what he looked like. And this is pretty standard sort of Renaissance garb. This is from the early 1500s, I believe, Flemish painter. And what's interesting here is the hand gesture, the book, the gaze, sort of the general depiction, because it would have reminded people at the time of another famous person. And you see here the comparison of making Hippocrates into this almost divine-like figure. And we talked about how Galen kind of did that to Hippocrates even in 200 AD. But you see 1,000 years later, that same kind of religious iconography in terms of medicine and the importance of physicians in monasteries and medical care. So monasteries were not just copying, preserving texts, but they were maybe the primary centers of medical knowledge and medical care because they had access to texts, they valued medical treatment, and they had sort of a stability about them that made them accessible to other places. They weren't too isolated. We think of monasteries as being kind of spread out all over the place. They were often not that far from cities and had relationships in terms of trade and so on. And they were part of communities, even if somewhat on the periphery. Some, of course, were very remote, but many of them were part of a town in many ways, including providing medical care. When we talk about medical care, obviously we're focused on diet in this class, but it's also important to think about the variety of kinds of practice that were happening even outside of diet. Here's an image of a physician practicing medicine with the patient. You can tell this is a monk or a religious figure of some sort because he's tonsured, he's shaved the top of his head, and he's holding this really large vial, and you can probably guess what's in here. It's yellow. Uroscopy, which is the examination of urine and the study of urine to determine disease, was a very important part of medical practice. We know that diet was an important part, the most important part of medical practice in terms of storing balance and so on. But you need to know what's going on inside the body. And physicians used every clue they could. You can see that he's holding the hand of the patient here, probably taking the pulse, and looking at the color of the urine to figure out what's going on inside the body. This tells them something about the course of the disease. And understanding the course of the disease, which is prognostication, telling the patient what's going to happen, knowing what's going to happen, and then being able to sort of counteract it through diet or through drugs if necessary, was an important part of establishing expertise. We talked a lot about that on Monday. How do physicians, establish a reputation? Part of it is knowing what's going to happen. It's not just about giving patients a drug or creating a temporary relief of symptoms. I mean, sometimes that's nice too, but it's about telling the patient they understand the disease, not just they can make them feel better for a short time. Snake oil salesmen, hucksters can give you some sort of remedy that alleviates your pain temporarily, but only a truly skilled physician is going to understand exactly what's happening and can prove that they know by telling you what's going to happen. So if this patient here hears from the physician, well, you're going to have a fever today, but not tomorrow, and then it's going to come back, and then it's going to stop, and then it's going to be really bad, and then you're going to be really hungry, and then you're going to eat, and then you're going to feel better. He says, okay, maybe, whatever. And then if that happens, he's going to trust this physician, right? He's going to think this person knows what they're talking about because you predicted the future, basically, because you understood the disease. So obviously, medieval physicians don't have X-ray machines, they don't have MRIs, they don't have ways of seeing in the body, they don't have, quantitative chemical analysis of blood in the same way that we do. Different tools, obviously, touch, talking to the patient, looking at urine, bowel movements, other things. They were able to see in the body in their own limited way, and that helped them understand what was going on inside the body in terms of disease. Uroscopy was a big deal. There's a lot of sort of tables like this that you can find in manuscripts and even printed editions of text. You can see sort of this like color wheel here, basically, of different kinds of urine. Same situation. Here's a patient bringing a flask, physicians looking at it, trying to understand what's going on inside the body. In addition to sort of basic medical practice like uroscopy, pulse, knowledge of plants was a central anchor to medieval medicine and to medieval medical practice. Understanding if you couldn't control the body through diet alone, what else could you do? Well, you could use drugs, and drugs were plants, combinations of plants. This one's aconite. This is actually potentially poisonous if used inappropriately. But you can see the drawing here in the description. This is in Greek. A lot of medieval herbals, they're called, have these descriptions of plants and these visualizations of the plants. Here's another text with these plant drawings. This one's even less realistic than the other one. It's easy to think that medieval artists were terrible, or people never went outside and actually saw anything. Like, how could these drawings possibly be useful? What purpose do they serve? Well, we can't think that they were necessarily for identifying things. We have a lot of guidebooks and field guides to different plants, to wildflowers, things like that. I have a lot. I think it's kind of fun to figure out what things are. But the reason these drawings are in a book like this isn't to tell a physician what a plant looks like. It's to remind him what something he already knows is. And so to remind him that this plant looks like this and has these properties, he's already going to know what the plants are. A good physician is already going to know what does what and what's available and what's not. This increasingly throughout the Middle Ages becomes something that apothecaries become more skilled at, and herbalists, and physicians start to have more theoretical knowledge, and we'll get to that in a second. Medieval medical texts were copied to preserve medical knowledge, but they were not just for preservation purposes. They served definitive functional purposes too. This is a sort of one of the front pages of a book about plants, kind of a printed version of what we were just looking at. And you can see that a number of different people have written in this book notes to themselves about plants, what pages things appear on. These books were heavily used. You can see the image of a scholar here studying. You can see that this is a place where there's files of things, jars, but mostly books. So studying books, getting medical knowledge from books, learning from past experience is very important. But it's not just about reading it, it's about using it. It's about taking notes, and it's about that active use. Here's another one. Again, there's a text that comes from some famous physician, but then a lot of sort of individual notes. There's at least 3 different people here, handwriting here, and handwriting here. These are all different people using the text, taking notes about how they use this herb, what they mixed it with, what disease it worked for, and so on. Arabic medicine was an extremely important contributor to what we would call the Western medical tradition, because it took so much of what was written down in the classical world, in the medieval world, assimilated it, put it together, added to it, and then kind of put it back into, or was reassimilated into the Western tradition in the sort of political, economic stability of the later Middle Ages. And we can't understand diet, we can't understand medicine, the history of medicine, without understanding the Arabic contributions. We're not going to spend a lot of time on this, but I wanted to make sure to mention that there's a very important component to our modern medicine that came through the Arabic world. Here's a treatise on plants, same kind of thing we saw. This one is showing an example of cautery. This is a leper receiving treatment, cauterizing wounds so that to minimize the chance of infection. They didn't understand infection and germs in the same way we did, but they knew that open wounds tended to end in bad news. And so cautery, burning something to seal it up, was an effective treatment. So you see that happening here. I just mentioned very advanced in terms of surgery. Here's some surgical instruments. Again, it's not that the instruments looked like this necessarily, super bright colors and everything, but they give you an idea of the kinds of tools, the kinds of shapes, the different kinds of instruments being used. They did a lot of dissections of parts of the body that hadn't been carefully researched before. Here's a drawing of the eye, looking at the optic nerve, looking at different blood vessels, sort of really understanding what makes up the eye in a way that, again, this is sort of very important innovations coming out of Arabic medicine. One of the most important contributions to the medical tradition came from a physician kind of like Galen, kind of like Hippocrates, named Ibn Sina, whose name was Latinized as Avicenna. This is a manuscript page from his medical text called the Canon, which was meant to be a synthesis of all medical knowledge, which was a huge undertaking. And this book, as much as any of Galen's writing, became a cornerstone of medicine in the Latin West. And you see the format here is Arabic, so it goes right to left, and you can see that this is the text and this is sort of the annotations and notes that someone else has put into the text. Again, these texts are being used by physicians, by people learning medicine. And this text of Avicenna's becomes on par with the great physicians that we've been looking at. So you see here Hippocrates, Galen, Avicenna, sort of the triumvirate of the Western medical tradition. Diet, as we've talked about, was a cornerstone of medical care, medical treatment. But there aren't a lot of standalone texts on diet. The physicians didn't write about specifically just diet, but they wrote about regimen. And they wrote books called Regimens of Health, which were sort of manuals for how to live well. And thinking about how to stay free of disease, or how to restore balance, or how to restore your health if you are in a disease state. It wasn't just about food. That was one of the main drivers, as we've seen, but it was also about just how you conducted your daily life, how much you slept, how active you were, what kind of work you were engaged in. And so most of our knowledge of diet comes in the context of these texts, where they're talking about what to eat and what to drink and how much exercise to get and what kind of exercise to get and when you should eat and how much. And so everything is wrapped up together. Again, these texts were meant to be used. Here's one that looks weird to me every time I see it because of all the blank space. Here, every little paragraph, every little idea gets its own annotation here. Okay, one important innovation we have to discuss or mention is the advent of the medieval university. Universities in southern France, northern Italy, northern Spain, Paris, Bologna, Montpellier, Padua started to create universities, centers of learning. Medicine became one of the biggest parts of early universities in the 1100s and 1200s. And you see here, this is from 1231, an edict from Emperor Frederick II, who's arguing here that, or making a law, in fact, that if you want to be a doctor, you can't just say you're a doctor, right? This is a really fundamental change, a foundational change in medicine, because you can't just say you're a doctor. You have to go to school. You have to study for logic first for 3 years. Then you study medicine for 5 years. And after this, you get a license to practice as a doctor, right? After you take a standard exam prescribed by the government and another doctor testifies that you know what you're doing. No doctor shall practice after the completion of the 5-year period who has not practiced for a year under the direction of an experienced doctor, right? So this a very different process. During the 5 years, you're supposed to teach Hippocrates and Galen in universities and instruct in the theory and in the practice of medicine, right? Standardizing medical curriculum. And it's hard to overemphasize the importance of this shift from having this very variegated medical marketplace where you could go see anyone who claimed to have any medical knowledge because it's a skill that they had acquired, to this very formal education in a university where you have a curriculum. And in 1231, there really wasn't any standard curriculums yet. They were just starting to emerge. Hippocrates and Galen and Avicenna were starting to become the sort of the pillars of the university curriculum. But you had to go through this process and get a medical degree, and this really changes the medical profession, because now you have people who are doing medical practice in the real world who don't know how to read, maybe illiterate. They have a lot of experience maybe, but they don't have a university degree. And on the other hand, you have physicians who have studied logic for 3 years and been at a university for 5 years and been apprenticed to a medical master for a year and have taken exams and have a license. Very, very different situation. And this changes not only the doctor-patient relationship, this also changes the cultural and social standing of a physician. And we're obviously still in the legacy of this shift. So this edict here, this is from 1231, didn't immediately change the medical world, right? A university degree doesn't matter if people don't know what it represents. So it takes some time for this thing to happen. But certainly by throughout the 1300s and 1400s, it became standard almost everywhere that there was this very sharp divide between physicians with a university degree and a license and people who didn't have one. And then that distinction has continued to sharpen, I think, over the last 500 years. Universities, this is a manuscript drawing from 1390, and I love this because this is almost like a portrait. Like this, if we were meeting in class, and it's too bad we can't, but if we were meeting in class, this is kind of what it would look like. Okay, there's someone in charge at the front of the room. I don't sit in the front of the room. I pace around. Reading from a book, I don't do that either, but this is how medieval universities worked, is that they had a master reading a text and students here annotating their own versions, right? You got the nerds in the front here paying attention, sitting up straight, looking at their books, and then you got the people in the back who are looking basically everywhere else. This guy's passed out, just like we would be. This is this is from 1390, so we go, within the span of 200 years, we have almost no university construct anywhere to having these formal masters, classes, degrees, and so on. Obviously, we're all here at this virtual class so that you can get a degree. It still means something. Okay, one other thing that I want to look at very quickly is just to give you a sense of sort of the continuation into the early modern world. I'll pull up a Google book here. This is a Regimen Sanitatis. I was talking about this literature. I showed you a bunch of manuscripts a second ago. There's a famous text called the Regimen Sanitatis Salernitum, which is sort of a manual for health that was produced in Salerno, which is a little bit south of Rome in southern Italy. This one was printed in 1507. You can see the frontispiece that has a very similar kind of teacher-pupil scene going on here. And you see this is so common. I just want to give you a visualization of what medicine in 1500 looks like. We're getting into early modern medicine on Friday. But this is the continuation. This is a physician who died in early 1300s. His text is being reprinted here in the 1500s. He's looking at a text that was produced in the 1100s. This is the original text. And then now he's adding a commentary. And you can see this is the structure of the whole text. There's the original text in bigger font size here. And then the commentary, the gloss. This is the whole thing, right? So if we look at just the grid view for a second, you can see the nuance, and you can see the how much sort of extra is going into the original text. And this is one thing that characterizes late medieval medicine. Beginning to deviate from Galen a little bit more. We see this more on Friday as well. And the complexity is tremendous. So every every little aspect of medicine gets analyzed. I spent a lot of time reading texts like this in my research on understanding medicine and poison in the late medieval world. And a lot of the discussions centered around what's the difference between food and medicine? And how do you differentiate? How do you know what food is most nourishing to you? What's it most like the body? Does it have to suit your temperament? How do you make that determination? And the argumentation can be extremely nuanced, believe me. And we won't get into that here, don't worry. But I want to show that there's a stereotype of medieval medicine being backward and ignorant and superstition and so on. And there is some of that, just like it's part of our medical practice. But it was also a very, very highly intellectual, highly learned, highly trained, highly skilled endeavor as well. And these texts are just, a tiny, tiny, tiny fraction of the material that has been preserved that is a testament to a tremendous amount of thinking and writing and learning and synthesis and innovation that's happening in medieval medicine. It's easy to think that the Middle Ages are kind of like the Dark Ages, where there wasn't really any culture, there wasn't any original thought, there wasn't anything. Everyone was just barely surviving, and it was a dark time. And that's a very deliberate Renaissance construction made to make themselves look better. It had very little grounding in reality. Certainly, early Middle Ages, there was a lot of conflict, there was a lot of turmoil, not a lot of artistic and intellectual growth. It's very isolated here and there. But by the late Middle Ages, and this text I think is emblematic of that, there's a tremendous amount of intellectual work being done, not just in medicine, but in every field. And so it's not at all true that there's some sort of general loss of medical knowledge through the Dark Ages. Like, people were gathering experience, they were writing it down, having more nuanced arguments. Here's a English translation of early English translation of Regimen of Health. Direction for the Life of Man. You see, this is the same text that we're just looking at in manuscript form. This is the exact same thing that we're talking about. And you can see the kind of advice that's being offered here. For man's health, you should shun busy cares, rash angers, which displease, light supping, little drink, do cause great ease. This whole thing is written in a poem form to be easier to remember. Rise after meat, sleep not after noon. Urine in nature's need, expel them soon. Don't hold urine, don't hold in farts. It's really common advice in these regimens of health. And it's easy to think, when you look at all those texts that medieval physicians and scribes and so on took themselves a little too seriously. But I just want to end by showing you that they also had a good sense of humor about, well, you can see for yourself. Okay, so that's it. On Friday, we read about Renaissance diet. The reading is much more focused on diet as opposed to medicine generally, although there'll be some overlap and some of the reading will seem familiar. That's good. I want to make sure we have this foundation for Western dietary thinking, because it really is the foundation. We'll see it over and over again the rest of the semester. So hopefully this lecture today helps you sort of situate diet in a much longer medical tradition, and will help the sort of continuities and discontinuities that I'm asking you to write about for Friday's weekly reflection. Hopefully that'll be a little bit easier, having a little bit more sense of what was going on with medieval medicine more generally. Okay, have a good week. I'll talk to you soon.